Now when we remove the first layer of the superficial muscles of the back, these are the trapezius and the latissimus dorsi, we can find three small strap muscles just under it, and these muscles are the levator scapulae muscle, rhomboideus minor muscle. Now let's see the origin and insertion of all these muscles very briefly. Here, so it is the image of the real skeleton of the back, and when we see these three muscles, first we have to understand all these muscles, they are going to arise from the cervical vertebrae as well as the thoracic vertebrae. Out of them, the levator scapulae muscle, it is going to arise from the transverse process of the C1, which is somewhere present here, transverse process of the C2, C3 and C4 vertebrae, and the transverse processes of the cervical vertebrae having anterior tubercle and posterior tubercle. And as this levator scapulae muscle, it is the muscle of the back, it is going to arise from the posterior tubercle of C1 to C4 transverse process. As this muscle is getting origin from this area, it is passes downward and laterally, making a curve and going to insert on the medial border of the scapula on the dorsal aspect between the superior angle and the spine of the scapula. So this is the levator scapulae muscle. When we see the another muscle, that is the rhomboideus minor muscle, it is going to arise from the spinous process of C7 and T1 vertebrae. And this muscle, it passes laterally and downward and going to insert over the medial border of the scapula at the dorsal aspect near the spine of the scapula. As this muscle, it is going to arise from the C7 and T1, it is also getting origin from the supraspinous ligament between them. So this muscle, it is the rhomboideus minor muscle. And this rhomboideus major muscle, it is going to arise just below the rhomboideus minor, but between the spine of T2, T3, T4 and T5 vertebrae and the supraspinous ligament between them. And this muscle is passes downward and laterally and going to insert over the medial border of the scapula between the medial border of the scapula on its dorsal aspect from the inferior angle to the spine of the scapula. So this is relatively larger muscle than that of the rhomboideus minor, and that's why the name suggests this is rhomboideus major muscle. So all these three muscles, they are going to insert over the medial border of the scapula on its dorsal aspect, starting from above to downward. These are the levator scapulae, rhomboideus minor and the rhomboideus major. Levator scapulae is going to insert from the superior angle of the scapula to the spine of the scapula. Rhomboideus minor is going to insert over the spine of the scapula, while the rhomboideus major, it is going to insert in a larger manner up to the spine of the scapula to the inferior angle of the scapula. When we see the nerve supply of these three muscles, all these three muscles, they are going to be supplied by nerve to rhomboideus, which is actually called as the dorsal scapular nerve, which is a direct branch from the root of the brachial plexus. Having root value of C5. Along with this nerve to rhomboideus or the dorsal scapular nerve, this levator scapulae, it is additionally supplied by C3 and C4 nerves. When we see the action of all these muscles, the levator scapulae muscle, as the name suggests, it is responsible for the elevation of the scapula, and this rhomboideus muscle, as they are relatively transverse or oblique and that's why this muscle are responsible for the retraction of the scapula. This rhomboideus muscle having some additional action with the levator scapulae, as they are responsible for the rotation of the scapula and depresses the shoulder also. So it is all about the superficial muscles of the back. Hope you understand. Thanks for watching.